back. We're on the final stretch of Talk to Doc, and it's time to take some questions from Doc Oyi and Miss Dina Bonnevie. Okay, questions from our audience?
Doc, what would your center consider aesthetic service, and what is the advantage of hospital-based aesthetic center?
Well, in our hospital, no doctor can practice there if you're not board certified of the specialty that you are practicing. So our center, we have board certified plastic surgeons. No? So aesthetics, anything that will enhance your looks, no? Anything that would enhance the looks of a person or complement or make it better looking. So that's part of our services that we offer.
Kaya
So,
pala ikaw yung head
I know.
So, Doc, you cannot create what God did not give you.
No, we can
Ganun ba
enhance
yun?
it. We
Enhance
Kasi
enhance
wellness
it.
nga eh.
We enhance it.
Kaya pag
And-
unang pasok nila doon, si Doc talaga yung makikita nila. Medyo, okay, may pag-asa to.
No. The patient who goes there, we don't just accommodate like you want to look like Miss D, for example. No, our doctors are not like that. No, so I want the nose of Miss D.
Kaya ano?
So we like I've said, we evaluate the person as a whole, and even our plastic surgeons, they're not like if you go there and walk in and then if you want the nose of this artista.
Actually, di ba one time I told one of the doctors, I go, Doc, gusto ko magpaayos ng ilong.
Ha? Ang ganda-ganda na.
Talagang he looked at me. That was the same
Yes.
doctor who told me I was fat. And I didn't sleep for 1 week. Sabi ko, sakit. Grabe, sinabihan akong fat. Hindi man lang, you're a little overweight. You're fat. Ang sakit, di ba? Tapos
Ano
ko,
sabi niya nung gusto mo nang
Sabi ko, Doc, gusto ko
paayos
magpaayos ng ilong. Then he looked at me. I'm sorry, you don't need it.
Ha?
Yeah.
Ganon ka, tak. Sabi ko, my God, kung ibang doktor yun, sure, when is the operation?
Well, that's good. At least you know, hindi
No,
lang
we
para
don't.
kumita, di ba?
So-
Sabi ko, kaya sa inyo mga nagtataka, mistisa ako, hindi fake yan.
Ayan.
May nagsabi ba naman, taray-taray, Miss D, gawa naman ng ilong. Sabi ng kapatid ko, hoy, totoo yan.
Oo nga. O,
Okay.
next question.
Doc, who can avail of the wellness center's services?
Anybody po, like what Miss D said, it's not just the absence of disease. Well, especially if you're feeling something already, or if you really want to take a proactive stance about your health, then we can help you po. Because sometimes there are diseases or conditions that may not present with any symptoms. But if you are at risk for it, like may genetic predisposition or your lifestyle risk factors, all these things we can help you po. So if you want, anybody who wants to take a proactive stance regarding their health, then we can help them po.
Importante may budget ka rin. No?
Ay, hindi na mahal.
Not really.
Pero hindi ganun kamahal. So,
Well, where would you want to spend your finances? Treating a disease or preventing a disease?
Yeah.
I think
we
you
have
know the
to
choice
consider
there.
that.
Wala namang membership fee.
Wala.
Wala. May ganun ba sa
Wala.
iba?
Hindi, kasi di ba, akala ko baka, di ba, if you're, baka naman pwede, Doc, in the future, if you're a wellness member, di ba,
May
so
discount.
may discount.
nga.
We even provide a free weight
Talagang-
management consult
Oh,
for in our center. So anybody who goes there who wants to find out about if their weight, they have concerns about their weight, or we call them weight challenge. No,
Pero you have to be
individuals.
ready for what you asked for, ha? Kasi nung nag-weight management ako, stricto sila.
Oh.
Sobra.
Tingnan natin. Next question.
Oh, for Miss Dina, being a regular at the Center for Wellness and Aesthetics, how has your definition of wellness changed?
Well, it has really changed. From before, I was thinking kasi you're only well if you're not sick, or you're only well if you're thin. But now, you know, you realize that you could be thin and not well.
Yes.
Wow.
Kasi di ba in show business, oh wow, she's so like
Payat.
skin thin.
Oo.
Payat, she's well. So yung pala, merong acid reflux, may ulcers, o kumbaga, or minsan kulang yung blood
Kapag payat,
count.
minsan TB.
Yeah, and it doesn't, yeah.
Hindi totoo yun.
Hindi, like at the time, before nga I was thin, but I had a buckle in my back. Oh. So it's not really na, you know, you're well because you're thin. So, you know, my concept of wellness changed. Then I realized that wellness was truly not just physical, which I thought it was before, but also mental, spiritual, and emotional. Kasi a lot of the diseases that I had, kasi I was out of ease. So a lot of the diseases I had were due to all of the stress, lifestyle, emotional garbage. Garbage talaga. Na kailangan tanggalin.
O yan, mga parting words na from Miss D.
I'd like to invite everybody to put more concern on their health and specifically wellness per se, which is mind, body, and in spirit. And since I have tried the wellness services of Medical Cities Wellness and Aesthetic Center, I invite you to come and visit so that you can experience your tailor-made wellness package, your wellness walk, because after all, in the end, your health is your wealth.
Yeah, very well
Yes.
said. Doc Oy.
Well, the Medical City has always advocated patient partnership. So we will not be able to help them if they're not gonna be, if they will not come to us. So you're welcome in our center. So let us help you. If you want to find out more about your health, how you can take a proactive stance to it, then we're there for you.
Okay. Thank you very much, Miss T, for gracing
you,
our show today.
Maricel.
Thank you, Doc Oy,
Yes.
for the information
Parang-
about the Center for Wellness and Aesthetics.
And thank you also to our studio audience for joining us today. So,
Well, before we tell them to catch our next
Yes.
episode, bigyan muna natin ito
Oh,
sa
thank
ating
you. Yes. This is for you, Miss
beautiful
D.
Wow.
Okay.
Nak
That's for
po.
you.
Thank you so much. Pwede na akong, I feel like a beauty queen.
You are the beauty queen.
Miss Universe 2010. Joke.
Catch our next episode as we talk about liver issues and how to manage liver disease.
So if you have questions about this topic, email them at talktodoc@medicalcity.com.ph. I'm Dr. Oyi Balburias.
And I'm Maricel Laksa Pangilinan. Remember, don't be afraid to ask because we can
Talk to Doc.